How old is too old for the O shot? Are you looking to turn back the clock on your intimate wellness? Well, discover the rejuvenating power of the O shot or orgasm shot. Whether in your 30s, 40s, or beyond, age doesn't have to define your pleasure. So join me as we explore how this revolutionary treatment can revitalize your intimate life and bring back that youthful spark. Stick around to the end to hear another way the O shot can help your health. It's just not about intimate pleasure. Today, I'm going to be diving deep into the O shot and answering all the frequently asked questions. I'm going to talk about how it works, what it does inside your body, how to know if you're a good candidate, what the treatment options look like, the results, the costs, the side effects, everything. The chapters of this video are in the description in case you wanted to skip anything. And don't forget to like and subscribe for more content like this. Let me know in the comments, what's your opinion of the O shot? Have you had it before? How did it go? What were your results afterwards? Would you try it? Why or why not? I'd love to hear your thoughts and answer any of your questions that you have about the O shot. So first off, how does the O shot work for women? Well, as women age, various factors like hormonal changes, childbirth, menopause can affect their intimate wellness. The O shot or orgasm shot offers a solution by utilizing PRP, which is platelet-rich plasma, to rejuvenate and enhance sexual function. So PRP is actually derived from your own blood. We take it out and we spin it down, and it contains growth factors that stimulate tissue regeneration and actually improve blood flow. So for women, the O shot can address issues such as dryness, decreased sensitivity, difficulty achieving orgasm. So we inject PRP into specific areas of the vagina and the clitoris, and the O shot promotes tissue regeneration, increases natural lubrication, and it actually enhances sensation. So this can lead to improved arousal, stronger orgasms, and overall sexual satisfaction significantly improve. Additionally, the O shot can help symptoms of urinary incontinence, another common concern for women. So it strengthens the pelvic floor muscles and the supporting tissue and regenerates them, which allows that pelvic floor muscle to help with fewer leaks and greater bladder control. So overall, the O shot helps women have a safe and effective way to reclaim their wellness while having little to no side effects or downtime. So how do you know if you're a good O shot candidate? Well, determining if you're a suitable candidate is really a conversation you should always have with your provider on what is your specific sexual health and wellness goals. Here are some of the indicators that you could benefit from the O shot. Number one, difficulty achieving orgasm. If you struggle to reach orgasm or experience reduced sensation, the O shot can help enhance sensitivity and pleasure. Number two, vaginal dryness. Hormonal changes, menopause, certain medications can all cause dryness down there, leading to discomfort. The O shot can help increase natural lubrication and help restore lubrication down there and improve the moisture. Number three, stress urinary incontinence. If you experience urine leakage during activities like coughing, laughing, exercising, this O shot can also strengthen pelvic floor muscles and improve bladder control. Number four, decreased libido. So a decline in sexual desire can impact your overall satisfaction. The O shot can help revitalize desire and arousal at the same time. We also recommend getting your hormones checked along with that. Desire for sexual enhancement. So even if you don't have a specific medical concern, but you just want your intimate time to be even better and increased pleasure, this is a treatment for you. Now, before undergoing the O shot procedure, you always should talk to a certified health provider and team with qualified credentials. At Genesis, all of our providers are certified in the O shot. You can look them up online at oshot.com. Make sure that your providers are certified. This shows that they have taken the necessary steps to increase their success rate and reduce any chances of side effects. They do it the way the O shot was meant to be done. Additionally, a provider can address any of your questions or concerns you might have about the procedure and its potential benefits. So what does the treatment look like, and how often or how many times should you actually do it? Well, the O shot procedure involves a series of steps aimed at rejuvenating and enhancing sexual function and reducing urinary incontinence. So before the procedure, you're going to have a consultation with a qualified provider or qualified team member that's going to specialize in sexual wellness. During the consultation, we're going to discuss medical history, your concerns, your treatment goals, and then we're going to explain the O-shot procedure, its side effects, and any potential risks that you may have. Number 2, preparation. On the day of procedure, your healthcare provider is going to cleanse the area and clean it up. We're going to also apply a topical anesthetic to reduce any discomfort during the injection. Most women just feel a pressure, but with the numbing cream we have, everything is numbed. There's going to be a small amount of blood that we draw from your arm, similar to a routine blood test, and we're going to spin that down and create that platelet-rich plasma that has all of the growth factors and healing properties that are going to promote tissue regeneration and collagen production. Then we're going to go through the injections. So once the PRP is prepared and you've numbed up significantly, your provider is going to inject it into specific areas in the vaginal tissue and the clitoris using a very, very, very small needle. Most women don't feel it because they're numbed. The injections are typically administered in the upper vaginal wall and the clitoral area to target the key structures involved in sexual function, sensation, and urinary incontinence. After injections, you might experience a little bit of slight discomfort, swelling, bruising at the injection sites, and a little bit of spotting of bleeding, but that will usually go away within 48 hours. As far as downtime and restrictions, there are none. You can go straight back to what you were doing before, immediately following the procedure. In terms of frequency, the O-shot is usually administered as a series of treatments spaced several weeks apart. We always recommend 2 at the beginning and then getting it usually every 3 to 6 months depending on your individual factors such as your response, your concerns, and the provider's recommendations. After the initial series of treatments, we always recommend maintenance. So periodic maintenance injections will help sustain the results for longer periods of time. So what are some of the results that you can actually expect from the O-shot? As a woman considering the O-shot procedure, you're going to experience several potential benefits aimed at improving sexual function, intimacy, and overall vaginal health, as well as reduction in any type of urinary incontinence. So number 1, increased sexual desire or libido. The O-shot can help enhance sexual desire and arousal by improving the blood flow to the area, stimulating nerve endings, and this can lead to heightened sensitivity and responsiveness during sexual activity. Number 2, improved lubrication. So aging, hormonal changes sometimes lead to vaginal dryness, discomfort, pain during intercourse, but the O-shot can promote the regeneration of the tissue and increase the lubrication. So it makes the activity more comfortable and more enjoyable. Number 3, enhanced orgasm intensity. So by increasing clitoral sensitivity and arousal, the O-shot may lead to more intense and pleasurable orgasms as well. So many women report experiencing heightened orgasmic sensations and increased sexual satisfaction immediately after undergoing the procedure. Tighter vaginal tissue. So the O-shot can stimulate collagen production and tissue regeneration in the vaginal walls. This results in a firmer, tighter vaginal tissue and can contribute to improved vaginal tone, elasticity, and sensation during intercourse. Number 5, reduced urinary incontinence. In addition to its sexual health benefits, the O-shot can help alleviate symptoms of urinary incontinence, such as leakage or urgency. So it strengthens the pelvic floor, which are the muscles around your urinary tract, and improves that. So it leads to better bladder control and reduced leakage. It's important to note that individual results can vary, and the effectiveness of the O-shot varies depending on factors, including your health, hormonal status, specific concerns, if you smoke, if you drink. All those can reduce the effect of the treatment. So how much does it cost? Well, the O-shot has a wide range of prices, and it really depends on several factors, including location of the provider, their level of expertise, and their certifications in providing the O-shot, any additional services, treatment package. So on average, the pricing is wide ranged from a few hundred to a few $1,000s. Now, it's essential to keep in mind that the total cost also includes consultation fees, follow-up appointments, any necessary pre- and post-assessments, and it's also important to remember that you are treating yourself. You want to improve your sexual life, your sensitivity, your genital health, and reduce urinary incontinence. This is the treatment for you. So what are some of the side effects of the O-shot? Well, the O-shot is a minimally invasive procedure that involves injecting PRP into the vaginal tissue to enhance sexual pleasure and treat various sexual dysfunctions. We've already gone through that. And it's generally safe. No side effects whatsoever. but it does have some potential risks. So number one is some discomfort or pain at the injection site. Most women feel some pressure. However, any type of discomfort, tenderness, mild pain is usually temporary and resolves after a few days. Number two, bruising or swelling. We are injecting, so there's going to be some bruising and swelling at the injection site. It's a common side effect. And again, usually mild and temporary and resolves on its own within a few days. Number three, infection. This is very, very rare. We've never seen it because we make sure that the area is properly cleansed and treated. There is a small risk of infection, however, with any type of treatment. And we take precautions to minimize this risk by using sterile techniques and ensuring proper hygiene during the treatment. Number four, allergic reaction. So there is a small risk of allergic reactions to PRP, however, it's from your own blood. So there almost is no signs or no chance that you're going to get an allergic reaction. I've never seen it in a decade of doing this. If you do have any rash, itching, burning, swelling, difficulty breathing, you definitely want to talk to your doctor immediately. Number five, unsatisfactory results. So while many women experience positive outcomes from the O shot, individual responses can vary. Our success rate is over 90%, but some women may not achieve the most desired result or may require multiple treatments to get them to their satisfaction. So always make sure you're discussing this with your healthcare provider, and they can help with personalized advice, address any questions you might have, and help you make an informed decision on whether this treatment is right for you. As a bonus, the O shot can also enhance overall vaginal health. In addition to its sexual benefits, the O shot promotes overall vaginal health by increasing collagen production, improving tissue elasticity, and reducing inflammation. So this helps prevent vaginal atrophy, improving tissue tone and firmness, and promoting general wellness in the genital area. We always recommend stacking the O shot with another treatment like FemiWave or other pulse wave therapy that can help increase blood flow to the area and enhance the results and success rate. Well, I hope that gave you some insight on the O shot for all of you women out there. If you still have any questions or concerns, comment them below. I'd be happy to answer them. And if you're interested in exploring the O shot for yourself, click the link in the description to book a consultation with one of our experts. Don't forget to like and subscribe, and we'll see you next time.